Welcome back to Rural Health News, the segment of Rural Health Today where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what's most urgent? Becker's Hospital Review recently reported that hospital pricing has become one of the most active state health policy battlegrounds now that more states are implementing a cap on what hospitals can charge commercial payers. Indiana, one of the most expensive states for healthcare, adopted the law in 2025 and now enforces employer health plan price caps below 260% of Medicare for 5 of the largest nonprofit health systems in that state. Michigan, one of the least expensive states for healthcare, is considering a much more severe price cap with a cost review board and immediate 10% price cut for all hospitals. Many more states are following these examples to implement cap prices across commercial markets with varying conditions, some intended for big system healthcare and some sweeping across every category of hospitals. For the rural nonprofit hospitals focused on breaking even and keeping the doors open, this kind of legislation is brutal and damaging to the communities relying on access to those hospital services. On to the damage report. The Federal Registry recently released an updated report on shortage areas for primary medical care, mental health, and dental health professionals. These shortage areas, called HPSAs, and determine eligibility for federal qualifying programs. HPSAs can be both urban and rural geographic areas, but as expected, the updated list highlights the disparity in workforce shortages for rural areas in all 3 professions: primary, mental, and dental health. The report also found that rural counties with the highest disability prevalence had the highest HPSA rates, meaning the rural communities needing care the most have the least access. And now for today's success story. In rural Allegan County, Michigan, hunger persists as a growing need in families with school children. Kids Food Basket, a nonprofit in West Michigan, has been helping provide nutritious meals and health education for young students thanks to the passion and support of local teachers, principals, and other school staff who see the need up close. In areas where families may not ask for help or even know where they can get help, it takes servant leaders in rural communities to connect individuals and families with resources on a daily basis. These kind of connections and long-term relationships don't meet just the immediate need. They create lasting systems of education that builds habits and sustains access for social resources. Just as rural hospitals serve as safety nets for their communities, other nonprofits and agencies like these play an integral role in providing compassionate care to those who need it the most. Thank you to our sources for this episode: Becker's Hospital Review, KFF Health News, Federal Register, University of Minnesota Rural Health Research Center, and Rapid Growth.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.